So next we have the discussion about the thromboprophylaxis. A 72-year-old female is undergoing an elective total hip replacement. What is the most appropriate thromboprophylaxis for this patient? So would it be intermittent pneumatic calf compressions, TED stockings and early mobilization, full dose of unfractionated heparin, inferior vena cava filter, or subcutaneous low molecular weight heparin? So, for this patient who is going for a major orthopedic surgery, subcutaneous low molecular weight heparin is going to be the most effective single pharmacological prophylaxis for this type of surgery. So, total hip replacement or total knee replacement carries the highest risk of development of venous thromboembolism. Now, low molecular weight heparin, low molecular weight heparin and enoxaparin is the most effective single agent which will be used for providing pharmacological prophylaxis against thrombovenous embolism. Now, low molecular weight heparin is combined with mechanical methods that includes the compression stockings and pneumatic compressions for maximum protection. So there are two things that low molecular weight heparin is the best option. However, it can be added upon with certain types of the mechanical methods that includes either the compression stockings or pneumatic compressions. Now there is one thing that these mechanical methods have one contraindication, that is the presence of the vascular disease. So that is one of the most important thing that you have to keep in mind, that you can be tested that the patient is having some vascular disease. Then which of the methods should be avoided? That would be use of the compression stockings and pneumatic compressions. Now, full dose unfractionated heparin will increase the bleeding risk. So we do not need that. Now, inferior vena cava filter are reserved for those patients who have contraindication to anticoagulation. So, our first method is to give the patient some sort of anticoagulation. For that, we have different options. We can use low molecular weight heparin. We can combine it with certain sort of mechanical methods, but we also have a third method, that is the inferior vena cava filters. So the thing that we need to understand is that low molecular weight heparin is one of the safest and best method. However, it can improve its efficacy by combining with the mechanical methods. However, if in certain patient we have some contraindication for the use of low molecular weight heparin, in those patients we will be using the inferior vena cava filters. So just an overview that for a low risk patient who is going for a minor surgery which is less than 30 minutes, early mobilization will be the best method to prevent embolism or thromboembolism from developing. For a moderate level of surgery, which includes abdominal surgery or a surgery which is going to take more than 30 minutes, the best combination will be low molecular weight heparin with TED stockings and early mobilization. For high risk, that includes pelvic surgery, hip fracture surgeries, total hip and total knee, low molecular weight heparin combined with compression stockings, and they can extend up to 28 to 35 days post surgery as well. So this will complete your concept. So low molecular weight heparin is most effective single prophylaxis. Combined with mechanical methods will increase its efficacy. Now, extended low molecular weight prophylaxis may be required for a period of 28 to 35 days after total hip replacement, and inferior vena cava filters are only used if anticoagulation is contraindicated.